Today we've got our annual Medical Student Research Day. This is really an opportunity for us to showcase all the hard work and research efforts that our students have put in over the past year. We've got over 20 projects here today that span a wide range of subject areas and different types of research.
So my project is a community effort of skin cancer recognition. It works with promotoras, who are community health workers, to try to recognize signs of suspicious lesions or melanomas.
Our project is on traumatically induced Holmes tremor with neuroanatomic correlation and video documentation.
So we are doing a case study of a 53-year-old woman who suffered a traumatic injury at 6 years old and has a lesion on the right side of her brain that affects the left side of her movement.
So many of our students will adapt their presentations and their work to take them to a regional or a national or sometimes even an international conference.
And so really the main message that I want to convey to the students is not so much about the science of my research, it's really more to show the students how in my professional life opportunities came up along the way.
So our project is CT modeling, and 3D modeling reveals hidden features of fossils from Palm Park, New Mexico.
So we know that when you lose your vision, it's a very stressful event. Our vision's important to everything that we do, but we actually haven't looked to see, there's not a lot of info out there actually looking to see if stress actually causes vision loss.
Our research project is immunohistochemistry and genetic techniques to detect SARS-CoV-2 in bats of New Mexico. And our goal is to find COVID in local bat species here in New Mexico.
Our project is about HPV and increasing HPV vaccination rates.
And specifically, our project is working with providers on their communication skills with patients about HPV to strengthen their recommendations.
So the name of our study is Serological Prevalence of Coccidioides in New Mexico. And what we want to do is look at antibodies to the fungus Coccidioides, which causes valley fever.
Burrell is really strategically placed because while we may be a small institution, we have expertise that span the gamut from wet lab research to taking our research and our questions out into the community. And we're well positioned to integrate fundamental basic science with applying that knowledge and that understanding in a clinical context or in public health context.